Good afternoon, I'm Aaron Burgoyne, and I'm here to talk to you about the 2013 National Patient Safety Goals, as well as show you how we incorporate them into our everyday routines.
I'm Dr. Hewitt from Bike Medicine at 355th Medical Group, here to talk to you about the National Patient Safety Goal in regards to patient identification. We hope to improve patient safety through identifying patients using at least 2 patient identifiers each time you're seen or spoken to by your PCMs. And so every time you check in at the front desk, you should be asked your name, social, or birth date. Same with when you get into the room with your PCM, or if you talk to them on the telephone, they should be checking in with you. So be mindful when you speak with your physicians, they should be looking for that, and that's what we do here at Bike Medicine, and we'll see you here.
Good afternoon, I'm Dr. Hughes from the 355th Dental Squadron, here today to talk about how we in the Dental Squadron promote effective control and patient safety. Of course, when our patients come in, we of course perform the timeout, and right before we have the patient sit, we want to make sure we're protecting ourselves as well as the patient. And one way in which we do that is we're going to place our PPE in the form of gloves, a mask. I've got my loops, my assistant will have her glasses. We also give the patient safety glasses as well to protect their eyes. And we'll of course don our PPE to protect us from any fluids or saliva or whatever aerosol that's produced during procedures. Another thing that we do a lot is dentistry is notorious for is that we anesthetize, and we have to use needles. So being that they're very sharp, we want to protect ourselves from injuring ourselves or our patients unnecessarily. So once needles are uncapped, what we want to do is we want to make sure that we're not putting them in with our fingers because it's the likelihood of having an accident. So we want to put something where it's stationary in the way, so I'm not going to jab my assistant. And so what I'm going to do, and this is what I particularly do, is I just have this to where I'm able to do this, and move it away and not have an issue. So at any rate, there are several ways in which we can do that, but certainly we want to avoid recapping while we're holding. Another way in which we promote patient safety is we use rubber dams on the patient. This will prevent the patient from ingesting materials or instruments while we're working on the patient. It also provides for a cleaner feel. We're able to provide higher quality dentistry. And one last thing that I think that we do here to also promote infection control is we disinfect our crowns and prostheses prior to them going back to the laboratory. And actually when they're processed in the laboratory, they're disinfected prior to coming back. And this is one we're protecting our folks here in the lab as well as protecting the patient from having any potential pathogens that may exist there.
Hi, I'm Major Pike, one of the orthopedic surgeons here at the 355th Davis-Monthan Clinic. Here in surgery we do some things that are different than the other clinics, and one of those is procedures. And of course for a surgery or a minor procedure, we have universal protocols that help limit the risk of patients. And of course wrong site surgery has been found to be a major concern nationwide. So if this is my patient here and I'm going to do a procedure, say a wrist procedure, the first thing I'm going to do is verify with the patient that we're actually doing that surgery, have the patient complete a consent form, and we'll verify that he has indeed had all of his questions answered. I will sign the site if I'm working on that site so everybody agrees. And then before we start the procedure, we do a final timeout where we actually confirm the patient's identity with name, date of birth, or 2 identifiers. We confirm the right side. We're indeed working on the right wrist in this case. And everyone there agrees that we're doing the correct procedure. We have the correct medication and equipment before we proceed. It's just one extra safety check that we do. And that's the timeout procedure, universal protocol, and helps us limit any problems from a patient safety standpoint.
I'm Sergeant Gatlin from the Medical Logistics Office, and I'm going to tell you a few things on what we do to prevent patient harm. And one of the things that we do back here, since we are the logistics, we have the back dock. So this is our area of responsibility. And one thing that is most important for us to do is to make sure that the guardrails stay in at all times. If they are removed, they need to be put back immediately as soon as you're done receiving deliveries or doing whatever you're doing that requires the guardrails to be off. Another thing that we have is our forklift, which is over here. And one thing that we do for the forklift is always make sure that the emergency brake is on and that the forks are always pointed downwards to the ground, so that way it prevents anything from getting in the way. Another thing that we do is that we always get a lot of commercial trucks and traffic throughout here, so always make sure that there's a spotter for any kind of vehicles when they're backing up, and also make sure that they honk and to create attention and awareness when they are backing up. As far as anything else goes, like I said, our main areas of responsibility are just making sure the guardrails are good to go, the forks are down on the forklift, and always have a spotter for any kind of delivery coming in or out. Thank you.
Good afternoon, everyone. I'm Master Sergeant Elka Sanchez. I am the Medical Group Patient Advocate. I have been asked to talk about ways that a patient can identify any safety concerns that they run across in the medical group. In reference to a safety concern, I would say that is something that needs to be identified immediately to any personnel wearing a medical group badge, or just present to any section, ask for a NCOIC, a flight chief, just anyone that can really take that concern to the appropriate channels and get it taken care of immediately. Additionally, I would like to add that there are section advocates in every clinical area of the medical group. These individuals are trained to help with any type of situation, whether that be safety or a patient concern. You can identify, those individuals can be identified by photographs that are placed in the various clinics throughout the medical group.
Hello, I'm A1C Rivera and I'm from the pharmacy. And the way we do our national patient safety goal is our barcode system. An example of that is this. Right here it's for Flovent, and if I scan the albuterol, it'll beep red and tell me that the product does not match. So then I have to find the correct product and scan again. Correct product is the Flovent, and it'll let me pass it through. In addition to that is our Coumadin. It's our blood thinners, and for our blood thinner patients, we count it only in our chemo area, so this does not get mixed up with anything else, and once we count it, we put it in our brown bags, and pretty much everybody in the pharmacy knows that if it's in a brown bag, then it's a blood thinner for Coumadin, and that we should be more cautious with it.
Good afternoon. Lieutenant Colonel Bill Fecky, the Medical Support Squadron Commander here at Davis-Monthan. Patient safety is what we're going to talk about here quickly. Patient safety is, we always talk about how it is everyone's responsibility. And it is everyone's responsibility because all of us in our daily jobs, whether we are medical support so that we're supporting the clinical operations or we are the clinic side, our actions touch patients every single day. So any of us can make a mistake that can impact a patient. So patient safety is all of our responsibility.